the medicine without prescription, which is illegal, and he could be taking it with a legal prescription coming from a doctor writing a prescription and giving it to the patient, and the patient comes to the pharmacy with a legitimate prescription, and he would take what he wants. And he could be doing several doctor shopping. He would go to several doctors, open files in several doctors' clinics, and taking prescriptions from several doctors and coming to the pharmacy. Me as a pharmacist, I'm doing the right thing. As long as I'm receiving the prescription, I can give him the medicine. This person is an abuser. The other kind of person is the person who brings the prescription and gives the medication to someone else. That could be maybe a brother of the addict who goes to the same doctor as his brother, and he takes in the prescription, gets it from the pharmacy, and gives it to his brother. It happens. Now, this is a picture that gives you some kind of an example about this. This is the one standing in front of the pharmacist as the addict requesting a prescription drug. The people behind him, I don't know who they are, they could be his friends coming in a group to the pharmacy, and they have prescriptions of the same medication. So they come into a group requesting medicine from the same pharmacy with different prescriptions from the same clinic probably, with the same medication. And they divert it to their addict, to other people. They could take it themselves, but they want to increase the volume by doing this. And all the pharmacist has to do is watch out for red signs or red flags. But what to do next? What do I do as a pharmacist? We all know that commonly abused classes around the world are opioids, and there is guidelines for dealing with opioids and narcotics. There is CNS depressants and CNS stimulants when we know their effects, if we know what they can do. Respiratory depression, CNS depressant can cause seizures, respiratory depression, and decreased heart rate. CNS stimulants can increase the body temperature. They can cause irregular heartbeats. CVS failures, fatal seizures, but most importantly, they can contact blood-borne viruses such as HIV, hepatitis B, hepatitis C. This is very dangerous and it's common. We've seen that happening. I took this from questioning a few addicts in Kuwait. And we need to do some research about this and understand what are the common drugs and the really common drugs that are being used. I think the previous lecture, I think, he mentioned the kind of drugs that are used in Kuwait. But, from my experience, I've heard the addicts talking about Revitol, Xanax, Valium, Rohypnol. I don't know whether it's still available now, but that's what they take as well. Valium, Lexotanil, Tramal, Lyrica. Lyrica is very common. I get so many people coming into the pharmacy asking for a Lyrica. A guy with muscles and everything, he looks extremely healthy. He's coming to the pharmacy several times asking for Lyrica because his mother has a disc pain. So I don't know whether it's true or not. So as long as I don't have a prescription, I will not provide it. But how risky can that be on me if this person is an addict? Oxycontin and oxycodone, I don't hear them much in Kuwait, but they are common in America, I think. Why is it rising? Why is it becoming more and more? Why are we facing such an increasing epidemic? Why is it happening? People are becoming more aware about the problem. We are trying to fight it. Everybody understands what addiction is. Not a shame anymore. It's a disease. So we sympathize for those people who carry this disease. And they will carry it for the rest of their lives, as long as they tried it for once. Even if they get treated, they are still at risk of trying it again. And that's the scary part of it. So why is it growing? I think more drugs are available. The population is increasing. More drugs are available to people. More prescribers prescribing more drugs. This is becoming, that's why it's increasing. So more people are using the drugs, more prescriptions are getting written, more drugs are being written for the patients, or maybe more drugs are just written by prescribers. Traveling is a problem. People can go to countries where the drugs are readily available. Alcohol is readily available in other countries, so that opens the door for young people, especially adolescents and young adults. This is the risky part. Of course, internet is a big problem, and we all know that. Now, we are all victims, whether you are a user of the drugs or a caregiver. We are a target. We are victims. If you deal with an addict, it's like you are carrying the disease yourself, because it's extremely difficult to be able to live your life with an addict. Okay, so we are all targets. However, let's put it simply, we care for our children, our teens, and young adults. These are the three main groups that are always targeted. You could be a patient that you have a condition, you go to the psychiatric doctor, and he would find out that you have anxiety or depression. He would prescribe something for you. You go and get it from the pharmacy. It could be the start of an abuse if you don't follow his advice and the instruction given by the prescriber. And that's where it starts. Okay, you cannot be blamed for that, but your decision of changing the instructions of the doctor can be a reason for being a victim. So our goals here, to bring awareness of the prescription drug abuse, to help pharmacists identify signs of potential drug abuse and diversion, to establish means for handling addicts and prescription drug abusers in a careful and cautious manner, to have in place a solid regulatory procedure for reporting suspicious behaviors and potential red flags of drug abuse. We don't have that. I have a pharmacy. I'm standing behind the desk. An addict comes into me with a prescription. I see all the red signs and the red flags that this is an addict, but I can still give him what he wants as long as the prescription is legitimate. He comes up a few days later or a week later with a prescription, maybe from another doctor, with exactly the same ingredient. As long as it's a legitimate prescription, I will give him what he wants. If I don't give him the medication, I don't know what's going to happen. Am I going to be safe? Is he going to be, happy that, if I advise him, don't take this medicine, I'm not going to dispense it for you? Is he going to be happy? If I don't dispense it, if I give him the medication with this legitimate prescription, what harm have I done to myself? Nothing. I gained something, I gained money. Okay? So there has to be a way. I'm protecting myself and I'm selling my medicine. These are two good things. So tell me one way that I can use to protect myself and not give him what he wants, and protect him from using me as a weapon to kill himself. So addicts have different times when they come to the pharmacy with, needing something. They can either come to the pharmacy when it's extremely busy and the pharmacist is rushing to serve the customers. Okay? Therefore, we will not watch out for red flags and we will dispense the medicine for him. By the way, Neurontin is not It's not prescription medicine, and it's sold, readily sold. People come in and then we sell it to them because it's not on prescription. Now, he can come in a quiet moment, and surprisingly, addicts understand. They are so clever, and they do their research, and they know exactly where to go and which pharmacy can supply them what they want. They know everything. Surprising information, the wealth of information they have is surprising. It could be more than the pharmacist himself. So they could come to the pharmacy that they have done their research on, and they will get what they want. They will come and they will speak to the pharmacist at the time when it's quiet and nobody is hearing them out, and they will speak to the pharmacist and they will get what they want from the pharmacist. This is another way. Plus, addicts, they are good liars, pathological liars. They can make up a story for every single pharmacist. They can come to my pharmacy and tell me a different story from the pharmacy next door. And we can both believe them because they are saying it in a realistic way. They are so clever in trying to get what they want. But I know these things because I experienced dealing with drug addicts. A critical moment in the interaction between the pharmacist and the patient in which a decision must be made involves several aspects. Does this prescription pass the lie detector test? He can get you a prescription, a forged one, with the right color and everything. I don't know how he would get it, but they can forge it and get it for you. And it depends on you. If you're a clever pharmacist, you will spot the forged prescription and do something about it. Or you can skip it. Okay, give me the prescription. It looks fine. Here is your medication. Does this prescription pass the truth test? What are the warning signs that flags this person as an abuser or diverter, as a behavior? You will notice the behavior of the addict. Pinpointed pupils, nervousness, scruffy look. They could be perfectly healthy, but they could be talking the slang language, street language. So there are signs that will make you understand that this person is not normal. He must be taking something. So should the prescription be dispensed or not? I know that the prescription has got a problem. But if the drug inspection department comes in and finds out that I have this prescription, it looks alright, the number of products, restricted products in my cabinet are fine, I'm doing the right thing, but deep inside me I know this is a forged prescription. So what do? What is it that I have to do? How can I deal with this addict when I'm specifically standing at night in the community pharmacy selling him this medicine? What do? How and when to report the red flags and to whom? There must be someone I can talk to. I mean, you put the ministerial decree, you put all these regulations on the dispensing of prescriptions, but okay, if I don't, and if I want to help and letting people know, or the authorities know that I have a lot of addicts coming to me, who do I report it to? Do I report it to Drug Addiction Center? Do I say it to the Drug Inspection Department, the Regulatory Authority? What do I need to do as a pharmacist? There are general red flags and yellow flags. I put them in two categories because some of them are higher suggestive. They are suggestive, highly suggestive of prescription drug abuse, and some of them are less suggestive. The ones that are really related to the pharmacy is obtaining prescriptions from unrelated sources. A gynecologist, for example, writing Valium. Why is that? As long as he has a prescription, it doesn't make sense. I don't know where he gets the prescription from, but it can happen. And it can, if I can pass it as a forced prescription, and I can pass it as a less forced prescription, or an authenticated prescription. As I said before, there are certain behaviors for the prescription drug abuser. The rolling of the eyes, the nervousness, the scruffy look, looking high, all these things are using the street language. Now, how do addicts take the drugs? They can either use a friend or a family to get the drug for them. Addicts know all the pharmacies, as I said before, where they can, get their medications from. They can combine drugs together. They do a cocktail of drugs. It could be the prescription drugs or the illicit drugs. They can mix them. And I think Kuwaiti addicts are very famous of doing this. Aside from, with regards to the forced prescription, aside from having the right prescription format, there is the handwriting problem. You cannot have we know that the handwriting of the doctors is very bad. So if you have a neat handwriting, that's a sign that this prescription is not right. The quantities. He has higher quantities than the ones we know. So there must be something about the dose. It can't be a doctor that prescribes this dose. It appears to be photocopied. Some of the people, they photocopy the actual prescription with the right color, and they bring it to a pharmacy with written instructions and medicines. Directions written in full with no abbreviations. We know what the pharmaceutical abbreviations. We use the pharmaceutical abbreviations, but that person comes in with the full instructions with no abbreviations. Plus writing in more than one ink color, different handwritings. All these things can show that there is a problem with this prescription. How can we contribute? By doing patient counseling to help people understand that there is some kind of a coping strategy. There is a way of identifying the altered prescriptions, networking with prescribers. So if the prescriber comes in, prescription comes in from a certain prescriber, and 3 days later another prescription comes in from the same prescriber for the same patient, you can call in the prescriber and tell him that this patient has got a prescription from you twice this week. What's the issue? What's going on here? Maybe he's too busy to notice this kind of patient. Reporting red flags and suspicious behaviors to the relevant authority, or participating in substance abuse education prevention programs like what we're doing now. All these things are contributions and ways of dealing with the problem. I'm just going to summarize this, that we need to use common sense in tackling the issue in the pharmacy. Common sense, good pharmacy practice, and looking for red flags to establish prescription validity. There are a lot of questions that we need to consider for the future events or future needs to deal with the prescription drug. How many non-medical users out there of the total unintentional overdose deaths are encountered every year in Kuwait? Emergency room visits, how many of them are from overdoses? What are the red flags behaviors that lead pharmacists to recognize and prevent abuse and diversion of controlled substances? How can pharmacists react to these red flags? All these questions need research. We need to do research. We cannot just go ahead and just do research only on scientific matters. This is social pharmacy and it has to be tackled. It's very important. Community pharmacists, they have a lot of gaps and a lot of... What are the parents' attitude toward prescription drugs? Surprisingly, some parents think that if their son or daughter take a prescription drug, it's safer than taking heroin or cocaine. This is education, this is culture, this is people who, they don't understand what a prescription drug can do. Number of people abusing prescription by age, by gender, the classes of drugs by age and by gender. We need to address this in our researches. Potential prescription drug abuse in schools and universities. We need to look for that. We need to study that in the faculty of pharmacy. Pharmacy regulations. Are there any effective methods for safely handling a drug addict in the community pharmacy? Insurance plans. We recently have the insurance plan for retired people. What if we have insurance plans that cover the prescription drugs, and somebody who comes in who's not covered prescription drug could be a red flag if he wants to pay it out of his pocket? This can be a red flag. So, as a recommendation, we need to minimize the prescription drug abuse and diversion using patient counseling services. We need to encourage people to protect themselves and their pharmacies from criminal behaviors caused by addicts simply craving their prescription medicine. We need to report any suspicious behavior or potential red flags for prescription drug abuse to the relevant health institution or national security services. These are the recommendations. Thank you very much.